Liar, liar, pants on fire. Joining us this morning is Dr. Vince Marin to expose the truth and the top lies that plastic surgeons hear from their patients. Let's start first with the first lie that a lot of doctors hear is patients who basically fib about how much they're actually smoking. This happens a lot?
Yeah, well, it's funny. Everybody lies to their doctor, I think, to some degree. And if you look at one of the biggest lies you can tell, the biggest problem is smoking. Especially in plastic surgery, it impairs your ability to heal. It increases the rate for infection. Patients can have a lot of problems as a result of that. And patients, I think, and they're notorious smokers for hiding that. I think there is still some embarrassment with that. And the one person you have to be honest with is your doctor, because it really can impair your ability to heal, your results, the complications, the risk with anesthesia. It gets you everywhere.
Just be straight up.
Without a doubt, because that's the one thing, especially with plastic surgery, that will hurt your end result.
Gotcha. Okay, next on the list this morning, top lies plastic surgeons hear. People who don't reveal their herbal medications that they're taking and that type of thing.
It's becoming more and more common. Patients are taking herbal remedies for just feeling better, more energy. The biggest issue that goes along with that is that, again, can impact your ability to your bleeding and clotting factors can be impaired by that. Also, how you handle anesthesia. You can have cardiovascular risk with that. Ginkgo, ginger, fish oil, echinacea, all these diet supplements. All of that can negatively impair your results. If you have bleeding after surgery, it could warrant another trip back to the operating room to stop that. So there's all kinds of things, and patients just think, well, I can buy it at, you know, Vons or at a health food store, and then as a result, they don't think it's a medication, but it truly can impact their health and how they do with anesthetics. Also, the biggest issue for surgery is bleeding.
So you need to go ahead and reveal everything that
all those medications need to be on that list, whether they're prescriptive or not, because it may impact how you do in surgery.
Next, let's talk about patients saying that their fat is returning after liposuction in really weird places.
The funny thing is that, you know, we treat an area, that fat we treat with liposuction is gone. It doesn't stop you from putting on weight. So we see a lot of patients that might come back to us and say, hey, I'm starting to put on fat in odd places. The interesting thing is that what you do is if you're going to put on 10 pounds, you can still put on 10 pounds. You just may have less fat in your abdomen, so you start to see it maybe in the hips or the thighs or an arm or wherever patients put it on, they start to see it coming back in different areas. So it's something we commonly see, that patients come back and say, now it's coming back in different places. It's not the case. It's just that your body, if it's going to put on weight, can find other places to put it on. It's not the normal distribution that you might see. So it's not really weird places. It's just maybe your second or third area of where you'd normally put on weight.
Gotcha. Okay, next, let's talk about skimping on prices.
Yeah, so a lot of patients, you know, right now, especially with the way the economy's been, patients will go through and look for ways in which to get some of these procedures done at a discounted rate. That's one area that I always tell patients you don't want to skimp with your health, whether it's plastic surgery or your regular doctor or whatever that may be. One of the things you see is that if patients can find less qualified people that are doing it, maybe doing it not in a certified environment, you can also have patients that, you know, or a doctor that's doing more procedures to make up for a cheaper cost, which means they don't have as much time to generate the attention to your specific problem. So you don't want to have someone who's rushing through this procedure to get more done because it's cheaper. You always want to make sure and check your credentials of your physician and make sure that they're the right person for that job, whether it's plastic surgery or, you know, your GI doctor or your ophthalmologist. Always make sure you have the right doctor.
Gotcha. Okay, let's talk about your dentist giving you Botox or filler.
Yeah. So anyone really with a medical degree in California can deliver cosmetic surgery. There's a lot of scope of practice that allows that to happen in California. So you have to be very specific, because if you have Botox or something simple like that, specific doctors, whether it's a plastic surgeon or maybe a facial plastic surgeon or dermatologist, are trained in a certain way to deliver that medication properly. People that don't have the same training can treat you in a way that seems right but might cause you a secondary problem. So there's a lot of things and a lot of training that you want to make sure that who's giving you these medications, again, are the right person for the job. They have the proper training. You can go and take a weekend course and learn how to do surgery to some degree, versus somebody like a plastic surgeon where you have to go and train for 6 years. So there's a big difference between a weekend and 6 years of your life.
And the reason that some dentists are offering this is because they can inject it in your jaw to keep you from grinding your teeth, right?
To a degree, yeah.
Yeah, and then they're putting it other places,
Well,
maybe? Or?
exactly.
Okay.
There's always people are trying to make up for, potential increased revenue in a business. And again, like with the economy, so patients say, you're getting your teeth cleaned, you have this issue, and by the way, we got a little extra if you want to do your forehead. But it's very specific. It is a true, toxin that needs to be very controlled in the way it's delivered. And you just don't want to say, hey, yeah, I've been thinking about it. I'm here. Let's just do it.
Yeah.
Make sure the right person's doing that for you.
Gotcha. Very good information. Thank you.
Yeah.
Okay, if you would like to reach Dr. Vince Marin, you can do so at Marin Aesthetics, located in Del Mar. The phone number's up on your screen. We've also linked his website to ours. Just go to fox5sandiego.com and click that Scene on tab.